Hi, this is Dr. Darren Schmidt at the Nutritional Healing Center of Ann Arbor. And if you've ever had an infection, then you need to treat your ears. So I'm saying this because I learned about treating the ears a number of years ago. I think it was 2009 or something. And at the time, I had a patient who was in the hospital once a month for 2 years with bronchitis. And they put her on steroids, antibiotics, and it was always a disaster. Her immune system was extremely weak. And then when I learned this, and we did the muscle testing procedure to find out what was going on inside her ears, I found some bugs in there, like bacteria. And then here's the key. You have to treat the ears by putting liquid herbs in the ears that will kill the bacteria or virus or parasite or fungus. The ears act like a safe harbor, and those bugs live there for as long as they want, and they don't ever go away, even if you take stuff by mouth. I don't care if it's drugs, herbs, supplements. Taking stuff by mouth will not kill the bugs in your ears permanently. You got to get rid of them permanently. So I've had people that had ear infections as a child, and now here it is 35 years later, and now we're finally getting rid of that infection. And because those things are, causing chronic sinus problems for their whole life. We fix chronic bladder infections, chronic UTIs, chronic low back pain, all because of the bugs in the ears. When the immune system goes down, these things thrive and they spread and they go wherever they want. When the immune system is strong, then these things hide. They go back up in here and they live there, and they just wait for the next time that you get stressed out or immune system goes down. So one other aspect of this is behind the ears. I drew an ear here. So the bugs could be inside the ear canal, going into the brain. Or if you flip the earlobe back like this, there's a bone, just feel behind your ear, there's that bump. That's the sort of the base of the skull right there underneath the ear, behind the ear. That's called the mastoid bone. And that bone itself can be the warehouse of the bacteria or virus or fungus or parasite. And a while ago, medical doctors would actually cut that out surgically and throw it away because they knew that mastoid bone harbored these bugs. So now we have better technology, if you will, better than surgery. You could actually just put herbs, liquid herbs, on the mastoid bone, like on the skin, and it'll absorb in on both sides. And then over the course of a couple months, or maybe up to 4 months, those bugs start to die, and then the problem goes away. And not just here, but in the sinuses up here. If you have any dripping down the throat, that's these sinuses that are overwhelmed with drainage, mucus and stuff from the immune system from fighting bacteria. It goes down your throat. So it gets rid of all that stuff. Now, sometimes you may have to treat the lungs. You may have to, address the lungs or the intestines. We've gotten rid of fungus in the body. Like if you wake up in the morning with a white coating on your tongue, that's a fungus that is in your stomach. It's in your intestines. And during the night for 8 hours, your mouth is closed, and it's a warm, moist place for the fungus to grow up to. And you wake up in the morning, you stick your tongue out, it's white, and you want to scrape it off or brush it off with your toothbrush. That fungus is all over inside your intestines. You got to treat that, and you got to treat the ears. Let me tell you one more story. I saw a woman, this is a number of years ago. She was at the University of Michigan Hospital, which is a few miles away. And one of my patients, who was a nurse there, saw her devastated health and said, hey, you got to go see Dr. Schmidt, which could have gotten her fired, but don't tell anybody that. So anyways, the patient came and saw me. So here's her problem. Her lungs were horrible. She had this horrible cough. It was really loud. Nothing ever came up. And she had the oxygen tank that she carried around with her wherever she went. She had the, oxygen was getting pumped right into her nose. And she was on the list for the double lung transplant. And when I tested her, sure enough, I found her ears were weak doing our muscle testing procedures. And I told her this, and she was almost in tears, like, this is something that makes sense. And I asked her, do you get this, this drainage down the back of your throat? And she said, no. And I was like, I can't hardly believe that. She goes, what, are you talking about, like the tickle? I said, yeah, the tickle. And she goes, oh yeah, I get that all the time. It's all day long. It lasts all day long. So anyways, she put the drops of liquid in her ears, the herbs in her ears, and over the course of 6 months, she got off the oxygen. She also lost 80 pounds because I had to change her diet around. And she was back to normal where she could walk around her house. And then she was able to walk around the block, and she got her life back basically. So if we had not done that, she would have had the double lung transplant, and those transplanted lungs would have gone bad too because the drainage from the ears, that was the main problem. So any infection in your past, like I don't care if it was a bacterial infection in your appendix or if it was a fungal infection on your toe, any of those, you got to get these checked out. So you can come and see me. We got hotels in Ann Arbor. You can fly in from California or Texas or England or wherever you're watching me and come in and see me, and we can go out and have a good time afterwards. Okay, bye.